So I'm Dr. Simon Amsdell, and the field of medicine, or orthopedics in particular, came from an injury probably when I was about a sophomore in high school. During football practice, I had a contact injury to my knee and found out later that it was an ACL tear, which went on to require surgery from a local orthopod and months of rehabilitation. And so that really exposed me for the first time to the medical field in any capacity. Throughout that experience, I had an interest in orthopedics and actually went on to shadow some of the local surgeons in the Oil City area, which really helped to further foster my interest in the field. Going on to college, when I was in ROTC, I actually had re-injured my knee again and tore my ACL again, which helped to really allow me to focus in on academics at the time, because I was still interested in sports. I was doing the ROTC thing, which was taking up a lot of time, but this really allowed me to focus in and realize that this is going to be the priority of my life going forward, is achieving that goal of becoming a physician and an orthopedic surgeon. So during my third year at Gannon University, that's when I started to apply to medical school, and among other schools that I had applied, I became accepted at West Virginia University, which was a relatively local and regional school that was close to home and family, and also provided an exceptional education for me. And fortunately for me, when I was there, they had a very strong orthopedic surgery department. My wife and I loved Rochester during the interview season and chose it as our #1 choice, and we're very fortunate to be accepted there. And then went on to the 5 years of general orthopedic surgery training there, which I feel provided me with a very solid foundation in all of the different aspects of orthopedic surgery, all of the foundations that would allow you to become a good orthopedic surgeon, a good general orthopedic surgeon. Certainly they were training us to be leaders and to be academicians and to go to big academic centers. But we always kind of had in the back of our mind that we had a passion to go back and serve the individuals of a small town type community. And it's a smaller setting, but they have everything that these larger systems have to offer, just in a smaller condensed package. I had always had an interest in doing general type orthopedics in a smaller town, but I started to think at that time what type of specialty would serve the area best and where would they have a need. And to me, that was in sports medicine and upper extremity type surgery as well. And so that's where my interest in the field of hand surgery and upper extremity surgery came from. And that's what landed me at the Cleveland Clinic, which has been really an excellent opportunity, and training me in all sorts of reconstructive, traumatic, minimally invasive type procedures that you can get at a very large referral center. And my training at the Cleveland Clinic has essentially been fingertip to shoulder, and so that's really been all-inclusive, from treating arthritic conditions of the shoulder, elbow, hand, and all the small joints of the hand, to treating traumatic injuries, including even loss of limb. Well, throughout the year here in Cleveland, we've done several joint replacement type procedures, which include larger joints, the shoulder and the elbow and wrist, and also the smaller arthritic type procedures, which include all the small joints and knuckles that are in your hand. About 1/3 of the year was spent that was strictly devoted to traumatic injuries, and so I spent about 4 months at the Level 1 Trauma Hospital in Cleveland, which is really the big referral center for any type of traumatic injury or fracture or broken bone. So I'm Dr. Simon Amsdell, and for my patients, I can ensure that our staff will do everything in our power to provide you with the best possible outcome and provide you with the highest level of care.